Head right into the KUAM News Zoom room where he's the former Physician Advisory Group Chair, Dr. Hoa Nguyen of AMC, the American Medical Center of Family Clinics. Good morning, Doc.
Good morning, guys.
What do you
the day.
What do you think of that Saipan, the CNMI news that they're now dealing with a little surge of their own?
Yeah, I tell you, it's interesting how they come into the community because they have the quarantine pretty very tight. But look like the governor did the right thing. They clamped down pretty much and put a lot of restriction there in place right away. So hopefully they can contain this little surge here through the contact tracing. It's not that big number, so they should be able to close down the close contact very soon. So good luck to our sister island there, Saipan. I think they will do okay.
Doc, it's definitely a different style of leadership when you had these cases pop up and you saw Governor Ralph Torres act. I mean, act quickly is a little bit of an understatement. I mean, this guy pivoted hard to shut down the schools, and they only had just a few cases, but he did this. The reaction, I feel, warranted because they haven't had community transmission in 200 days, whereas here on Guam, we get 16 weeks of high positives and people dying, and there's like no action at all, no change.
Yeah, that's a different way to approach it. I think they really go very strict on this one. Again, the whole island is very safe over there. So to have even 5-6 Ks is a big thing, and they have to really clamp it down in order to control this and go back to zero community transmission again. And the way they do it, they should control that within a week or two. So they did it before. So again, they just do the same things, and then they should be okay. So again, hopefully they can contain, and more likely, if I'm going to be guessing, it's probably the Delta virus that hit them right now.
Wow. Well, let's shift gears a little closer to home. Well, home actually. What are you seeing at the clinic level, Doc? Because I mean, I know it's over the weekend, and sometimes when they report the numbers over the weekend, they're sometimes a little bit low, right? Because they're reporting the daily tests, and we don't get those public health tests on the weekend. So, but what's your take on just looking at these numbers here? Do you think that we're starting to come out of this thing?
Yeah, I think we should come out of this thing. I've been lasting way long enough for the Delta already. So in the clinic level, we see less number of positives now than before. So it'd be interesting to see this week on Monday, Tuesday, and Wednesday to see if we hit less than 100. Hopefully that's our goal, and with the testing continue. But with the Halloween the Halloween just yesterday, we will see if next week the number will pick up or not. That's a typical one of those get-together holiday that we might bring up the number again. So hopefully not. So we will see the impact of Halloween probably sometime next week.
Wow.
Have you heard whether or not the CDC team of deployers is on island? We've been trying to get a hold of public health to get confirmation on this since last Friday, and also just messaged the governor's office and still waiting for an answer. Have you heard anything?
Yeah, we were talking about among our doctors here, and we're hoping that public health at least give an update on a daily basis to see what CDC are doing. I think that's the way that I think that you can earn the trust of the people in Guam in updating them. So what's going on? I know they're on island, so it's nice to have an update on a daily basis. Again, just to let people know what are they working on. They might not have an answer yet, but at least people know that they're looking at it. So I think it's a nice way to communicate and be transferred back to the people.
Why wouldn't they want to announce this type of thing, though, Doc?
I can't answer that. It's just something that to me, communication and update the people is very important. So I hope that they listen and they will say something on a daily, just like on the jig at least, so that way people know what's going on. But we will wait. If they don't update, then we will see what CDC will release some finding. Hopefully, they find something because again, we are still, to me, is way outside the norm of the U.S. We shouldn't be lasted this long, and our breakthrough rate should not be this short. So.
What do you think it is, though, Doc? I mean, you're right. It is. We're kind of sticking out here.
Yeah, I think our comorbidity is played a big part of it, and I think that the way that we did our immunization and the uptake at the beginning, we went up really fast, and it's just that at this point, more than 6 months out, those initial uptake of all the shot we're giving in December and January, it definitely are waning off already. So this is where I think we really have to put everything out there for the booster in order to make sure that our people, the immunity, been re-inert, like they need to kind of get the booster in order to get the immunity go back up again. It's really, we just give our stuff way early at the beginning. So those are stuff that we can only guess, but again, CDC will hopefully dive into, especially the DOA, and then also look at to confirm that our comorbidity is the only reason that we have so short of an immunity of 4.5 to 5 months. Yeah. But it's nice to have an update.
Yeah, I mean, I don't even know if public health, is going to tell us what the CDC said. I mean, they don't even want to tell us the CDC is here. So if the CDC does look at things and they find out stuff, how are we going to find out? Or is public health going to be forthcoming? They should.
Yeah, I think those should be published. So I think that we will find out either way. So I think it's very important for our island to adjust ourselves because, like I say, this Delta variant is not going to be the last one. And if we have anything that they call escape variants, then we'd be in trouble. So we need to know what we need to do in the future in order to prevent the surge we have right now.
What are you seeing at the clinic level, Doc, in terms of, let's just start first with sick visits.
The sick visit, they still there, but the majority is not COVID. So thank God they just have a cough and cold. But I still encourage people to come in to be seen if you have any runny nose, congestion, or cough, just to be tested because we all have to. The more tests we run, the better. We can identify the positive and try to isolate them. So we should not be slowed down in the testing. Testing should continue, until the surge are coming down to single digit, hopefully.
What have you heard about the monoclonal antibody treatment, Doc?
Yeah, it's doing very well. I think that now that the Manila Center have stood up now for several weeks already, and they've been giving a lot. And again, I don't think they turn anyone away. Our supply of the medication is we have plenty, so we should not turn anyone away, and that would definitely curb the hospitalization. I think that without the monoclonal antibody, I think the 50 that we have right now in the hospital will be a lot more. So that treatment is very effective. So I encourage people that, again, pass the message that if you go to any testing center and test positive and you are not given a referral for the monoclonal antibody treatment, you can go straight there, and and they will screen you and give to you if you meet certain criteria. But again, we still have testing center that does not do their job and identify the risk factor and didn't refer them to the treatment. So again, people need to know the treatment is there. So if the testing center don't give to you, you can go straight to Manila Center.
What are you seeing at the clinic level as far as the boosters? Are you seeing a lot of people trying to come in, Doc?
Yeah, I tell you, we have a long list of people for a booster. We give anywhere from 20 to 40 at least a day in the clinic. I know UOG have been very busy. I was hoping that the microgen won't still stay open, just because I think that besides the booster, that we try to push the 5 to 11 years old should be coming up pretty soon. So we need to have every place that's open in order to for us to support the booster for the third shot and also for the 5 to 11 years old. You know, it'd be interesting, you know, to see the 5-11 because you know there's a study show that you know most parents feel much more comfortable get the children vaccinated in the clinic rather than the public place. So it'd be interesting to see how this thing roll out.
Oh wow, interesting. Who are you seeing though, Doc? Like who's the first wave of the people coming to get the boosters? Is it kind of like everybody or mostly elderly?
You know, no, I tell you, everyone that we see, especially on when we do chronic care management, people have multiple comorbidity. If they meet the criteria, we give to them. You know, so during our visit of the chronic care management, we usually give them right there. You know, so and also they ask for their family member to come in. So we just put them on a waiting list and call them as it and make an appointment time for them to come in. So I think the booster at the clinic level is it really helped out a whole lot. You know, so again, we should keep every opportunity, every place, every location open in order for people to have easy access to the booster. I think that's the only way that we can, again, curve this surge and along with the 3W, and so we can have somewhat near normal holiday with Christmas and New Year coming up.
Doc, what are you hearing in terms of reactions to the booster shot?
You know, people have some a little bit of a reaction, just like the first 2 shots. You know, some just like personally for me, I just have a little bit of a body ache, a little bit of a fever for a few hours, and then it go away. So whatever you have on the first 2 shots, more likely that's what you have this time. You know, so especially Moderna, it's only half a dose, so you shouldn't have that bad of a reaction from the shot. But again, it increased your immunity a whole lot. Coming to the holiday, so that way, you know, we make sure that we get together with our family, that we minimize the risks of getting the virus. So it's really helpful. So I really encourage people to come out and get the booster as soon as possible. You know, like I said, UOG and at your own clinic, they should be able to give to you, and also at some pharmacy, they can also give to you. So, you know, whatever convenient for you, just get them.
Thank you, Doc.
Yeah, you know, I tell you, we should, and I think the governor and the PAC should look at the mandate. I tell you, I see a lot of things about the mandate and stuff. I think they should relax the mandate and let people that are unvaccinated do their own stuff and ask them to be tested in order for them to attend, you know, the restaurant and the gym and all that kind of stuff. It's very important for them to go back and our community united again. We are 90% plus already vaccinated. The rest of the 9% that not vaccinated, after 4 months of mandate, if they're not going to get vaccinated, they won't get vaccinated. But life needs to go back to normal, and they need to be able to test in order to do things, including going to a restaurant, because the public gotta know, and we have to rule by science, right? And we cannot make guideline by fear. I would be more comfortable sitting in a restaurant next to someone unvaccinated that been recently tested negative, because I know that person is not infected, rather than sit by someone vaccinated, not tested, and carry the virus. So we know now that both can carry the virus. So to have an unvaccinated person and disallow them to participate in a daily routine like resting in the gym, to me, I think it's going long enough, and we have to now use our science and make the decision. Because I tell you, an unvaccinated person that been recently test negative will not carry the virus. So let's get our community, together and stop dividing them. I think 90% plus, we should be able to treat vax and unvax the same at this point.
Realistically, though, Doc, I mean, the governor kind of seems like, well, let's just say this hasn't changed in months, right? Do you really anticipate her? Well, the public health emergency was extended, right, Bree?
Yes.
Until forever?
Until November 29th.
Until November
30 days.
29th, right? So.
But still, guys, I think we are the only place.
I mean, I'm sorry, Doc, before you continue, guys, can you imagine if you're like an unvaccinated person and your family decides, oh, let's go to the hotel for Thanksgiving? Like, you're totally screwed. You're screwed.
Well, Chris, the only thing I'm worried about, right? I know a few people that have the CDC card that they're not vaccinated. So, when people go underground and start that kind of stuff, it's dangerous, right?
Wait.
Because they can have a CDC card and they're not vaccinated, they're not tested. So you don't know.
Is that fraud?
Oh, no.
If you have a vaccination card and you're not vaccinated?
It's very easy to obtain. I tell you, that's something that we have to, to be able to let the unvaccinated be tested, and they go to restaurant or gym. Like I say, science is there. Both can carry the virus. Okay, but if you let the unvaccinated test it, and in order to attend the normal stuff, you'll be much safer and know that you sit by someone that recently tested and they are negative. And the tests are very good. If you're negative, you're not going to have them. So there's no sense right now at 90% that we continue to do what we do, and continue to divide the community. And I tell you, the longer we wait, the worse it's going to get. So I think that right now we should somewhat think differently and let people go on their life at this point.
Right, Doc. So, I'm just looking at the latest numbers. 123,866 of our island's eligible population. They don't put the percentage, but yeah, it's not in the JIC report. I think they stopped that over the weekend. So I'm still trying to understand this. So do you think that we may see something where you're going to have the booster shot in order to, go?
This is what Dr. Lombard had said, Doc. He was saying that they're going to, he anticipates that they're going to change the definition of fully vaccinated to include the booster shot.
Do you think that might happen?
No, I think the 2-shot will be the goal. I don't think that they will change to the booster in order to be fully vaccinated.
Okay.
I think that people that have the 2-shot, they still have 40-50% of their immunity at this point, except the J&J, that they really need to get the second shot as soon as possible. I don't think they're going to change that soon, unless you're about a year out from the time that you have your second shot. I think that the booster will help to curb the surge, but I think that still people that have the December and January shots should be able to be good until December this year. So, but the sooner they get the booster, the better. They need to raise it back up to at least 90% anyway, especially going to the holiday.
All right.
So,
Maybe they're going to do it
that's-
so it's like if you have a booster, then you're a real VIP, and it unlocks a whole other level of things.
Yeah, we have to change it to the third shot, and but I'm not sure about the fourth one.
Yeah.
So,
yeah, I know. And then the fifth
yeah.
one and the sixth one, and on.
At least an annual one should be the one we're looking for. But essentially, so yeah, I want to really ask them to see the PAC, suggest the government change the mandate, because I tell you, you have to. It's been long enough, and again, you won't go nowhere at this point. I think it's better to go after the booster rather than to try to make it hard so that the unvaccinated people will get vaccinated. 4 months, yes, the unvax has spoken up, and they will stand their ground and they will not get vaccinated. So I think we should move forward and let them come back to their normal daily routine.
Mm-hmm. Dr. Ho, you said something about CDC being here. Are you 100% sure that they're here? Because we've been trying to get a confirmation from Public Health and Adelup on whether, in fact, they are on island.
Well, they supposed to be here the last week of October, so I think they're here already.
Well, you can see we're put in this position when we don't get a response from our government that we have to start looking for answers in other places.
Yeah, because if they get delayed, I think Public Health should already announce that they get delayed for some reason for their arrival. So I assume that if they didn't announce a delay, then that means the CDC are here. But again, we just asking to see if we have an update on the thing. I don't think the PAC know neither of what's going on. So it's they really need to shed some light on the daily briefing to know that hey, they are doing something for us.
Maybe it's top secret.
And,
No, well, they announced that they were coming. I mean, I don't understand why.
They be here already. But again, as people go out and get the booster guide, they really need to get it. We need to get out of this hole here. Again, by next week, yesterday I see there's so many cars on the street, so I'm hoping that this Halloween event yesterday didn't raise our number for next week. But we will keep our finger crossed and hope not. So that's something we really have to be careful. But again, it's back to the 3W. So we hoping people follow that in the next few weeks.
Thank you, Doc.
Thanks, Doc.
Okay. And guys, I saw the letter from the Binax, the engine testing, the expiration date. I'm not sure you guys noticed that.
Yeah.
But just to let the community know that the Binax engine kit have been expired. I think sometime in May or June, but I'm pretty sure, and I remember that the CDC have extended that for a year. So the expiration date on those boxes, I know expired, but it's still good to use. And I know that's it's not good for people to tape it and not know the answer. But just want to let people know that it's still safe to use a Binax engine card that expired because it have been extended for a year. Okay, so I know I saw the letter Senator Moylan sent out to ask for clarification, but I just want to make sure people know that we still can use that.
Thank you, Doc.
Thanks,
You're
Doc.
welcome.
All right.
And be safe, guys.
You too. Be safe. Right on. Okay.
And come in and get your booster.
We're on the
okay?
way. Yeah.
Sure,
Got
for
it.
sure.
Yes. Once he starts wagging that finger,
I know.
you're-
Doctor's orders.
9:10.